You asked for it, so here it is, the top 5 most complicated surgeries that I'm a part of. For those who don't know, I'm Dr. Hassan, board certified trauma anesthesiologist. So starting at number 5, this is a crash C-section. What is a crash C-section? It's when the baby inside the mom is having decelerations and the baby needs to come out as soon as possible because they could be suffering from hypoxia. Now typically this is done in rapid fashion. If they have an epidural, we use the epidural. If they don't, it's a general anesthetic, but it happens very quickly. There's a lot of chaos and commotion, so that's why it's number 5 on the list. Number 4, we got flap surgeries. This is when a plastic surgeon uses a different part of your body to create a flap, which is basically a covering that covers up a wound, infection, burn, and or other type of injury. Now the reason why these procedures are very difficult is because they take a very long time, and typically they do not want any medication that increases your blood pressure by constricting your blood vessels, because they have to connect every single blood vessel inside the flap to the new portion. So for example, if they take a flap piece of skin off of your shoulder and they want to put it onto your elbow, on the other hand they connect every single little blood vessel. It takes hours under the microscope. It's a long, very meticulous surgery. Number 3, we have brain aneurysms. Brain aneurysm surgery, when it's open, meaning they have to go inside of the, and apologies for my hair, today's Saturday, so my hair's a little bit off. But brain aneurysm surgery is when they go inside your brain, open up your skull, and they have to correct a blood vessel. The reason why this is so much anxiety provoking is because they need the blood pressure in a very tight control, so typically in a 10 to 20 point range. But not only that, they need everything to be very still. They need the patient to be very still because the vessels they work on are extremely tiny inside your brain, and they can't really afford to have any movement or any injuries. If something were to happen, it could be catastrophic. Number 2 on that list is open heart surgery. Now, open heart surgery is when you have to have your valve or your coronary arteries fixed because they can't be fixed through percutaneous means. This requires you having to go on cardiac bypass, which requires a lot of work up front and intraoperative to manage blood pressures, heart rates, and you have to work with a huge team of people, including a perfusionist, the cardiac surgeons, PAs, nurses. It's a big effort. And number 1, the most complicated surgery that I'm a part of that is done frequently and routinely is liver replacement, liver transplant surgery. It is absolutely the most nerve-wracking surgery you're a part of. When they reperfuse the liver, basically your entire body goes into shock, and you have to manage that shock and get the patient through it. Because there's different phases to the surgery, but basically when you don't have a liver at all for a long time, a lot of toxins spread all the way through your body. If you like this content, please follow for more.